Declining physiotherapy care, a growing concern. A recent survey has revealed a concerning trend in the healthcare sector, particularly for stroke patients and individuals requiring intensive physiotherapy. The findings indicate that inadequate hospital facilities, including limited space and equipment, are leading to a decline in the quality of care provided by NHS physiotherapy staff. The Chartered Society of Physiotherapists surveyed over 2,000 members, and the results are alarming. 4 out of 10 NHS physiotherapy staff have either lost or are at risk of losing dedicated rehabilitation areas. Moreover, 6 out of 10 respondents reported that their rooms have been occupied by other clinical teams, often due to funding constraints or a lack of prioritization from management. Sarah Hazard, the Society's assistant director, expressed shock at the continued neglect of rehabilitation spaces, stating, 5 years after the pandemic, it's shocking that rehabilitation space continues to be sidelined and routinely taken away from physiotherapy teams, who are then forced to provide care in corridors. Hazard emphasizes the critical role of these spaces in helping patients regain mobility, recover from strokes, and rebuild their lives with dignity. The survey's findings highlight the challenges faced by NHS physiotherapy staff. A staggering 74% of staff reported a decline in the quality of rehabilitation they could offer, while 57% mentioned reduced access to essential equipment. Additionally, 51% of staff observed increased disability among their patients, and 53% predicted higher readmission rates for those under their care. One NHS physiotherapist working in stroke rehabilitation shared their team's struggle, stating, "We're dealing with an utterly inadequate rehabilitation space that fails many of our stroke patients. The therapy gym has been reduced to just 15 square meters, making it impossible to meet the target of 3 hours of supervised movement daily, along with group activities with other patients." The survey's implications are far-reaching. Andy Fletcher, the chief executive of Muscular Dystrophy UK, described the figures as alarming, reflecting the challenges faced by individuals with muscle-wasting conditions. He noted that the reduction in rehabilitation services has created a postcode lottery, where many patients are missing out on crucial care and support. Despite the concerns, the Department of Health acknowledges the importance of physiotherapy in patient recovery. A spokesperson assured that the government is committed to ensuring NHS staff have the necessary facilities and resources to deliver high-quality rehabilitation care. However, the shift towards community-based care may not be sufficient to address the current challenges. The survey's findings raise important questions about the future of physiotherapy services and the impact on patient care. As the demand for musculoskeletal care continues to rise, it is crucial to address the underlying issues and ensure that rehabilitation spaces are protected and adequately funded to provide the best possible care for patients.